are here with Ron Clinton from Knee and Spine PT. This is Ron's Teachable Talks, and today we have a new topic. Ron, you ready for our question?
I am ready.
Okay, so for the people out there, I know this is probably a common thought, but your doctor might have said to you, hey, you have a lot of arthritis in your knees. You may need a knee replacement. Ron, what do you think some of these folks that are hearing this, what do you think they should do first?
Well, a lot of people will just say, well, I guess that's all I can do. I'll do whatever the doctor says. They're the experts on this. Well, I had a patient recently he's 83. He's a semi-retired professor at a college. And he was told he needed knee replacement in both knees. We have been working with him, and he is not going to get those knee replacements because the exercises that he learned in therapy, he is able to use on a regular basis to control his symptoms. And he's decided that that's going to work for him long term, and he's not going to get the surgery. He still has the serious arthritis in his knees, but he is not going to get the surgery because he can control it, just like if he had a medication that can control it, but there's no side effects to these exercises, okay? And another thing to think about is that we know from research that 20% of people who have total knees are not satisfied with them totally. That's a big percentage. And it's not like total hips. Total hips, most people are very satisfied with those. For whatever reason, it doesn't always work out as well with the total knees. So if you can do something conservative first, you're much better off. And one thing you can easily do is get a copy of the booklet that I wrote, self-managing knee pain, 52 tips before considering surgery or injections. And you'll get a lot of tips in there. It's a good place to start. It's on Amazon. It's very cheap. The idea is to get information out to people so that they can learn about their options, make better choices about the treatments that they receive. And if they want further information about self-treatment, they can go to the course that I created, which is on the website kneeandspinept.com. It's right there. It shows you all the modules that you would take. And in one program, you're going to get like 10 visits of PT for the price of one. So it's a really economical way to start exploring self-management in a more detailed way than in the book, because there's videos that show you how to evaluate yourself and how to treat yourself. So that'd be another good place to start.
Yeah, and Ron, you've had such success in helping your clients avoid surgery. What is the special modality that you might use, or a type of therapy that you use that is really helpful in aiding in this process?
Right. And that is what is called directional preference exercise. And it was really discovered by Robin McKenzie, and he teaches the McKenzie Method. And I'm certified in that method. And I've also trained clinicians in the Southeast Michigan area at clinics that I'm associated with in West Bloomfield, St. Clair Shores, Shelby Township, Berkeley, and in Rochester, where I am. So we have multiple people who can give you this type of treatment if you're in the Southeast Michigan area. If you're in another state or another country, you can go to the McKenzie website. You can look that up online, McKenzieInstituteUSA.org or McKenzieMDT.org internationally.
Ron. That's awesome. So everyone listening here today, you can get some online resources, but you can also see Ron directly, and hopefully we can, avoid you from having a very invasive surgery, and you can give a little self-help. Thanks, Ron.
Thank you.